Good morning. On Tuesday, St. Louis County received 6,000 vaccine doses from the state of Missouri. That delivery contained last week's doses, which got delayed by the weather, as well as this week's doses. We understand that moving forward, the state will be able to send us at least 3,000 doses per week, an amount that should grow once the vaccine supply increases. St. Louis County has built an infrastructure to administer a large number of vaccines efficiently and effectively, again dependent upon the supply. We now have 8 locations where we administer vaccines: the John C. Murphy Health Center in Berkeley, the Florissant Valley campus of the St. Louis Community College in Ferguson, and fire district sites in Afton, Bridgeton, Eureka, Maryland Heights, Melville, and Pattonville. As a reminder, no walk-up service is available. All vaccinations are by appointment only. The Department of Public Health has already exceeded its early goal of administering 5,000 doses per week. And over the next 7 days, we intend to administer 6,000 first doses and 3,000 second doses, for a total of 9,000 vaccinations. That will be a new record for St. Louis County. But we know we can do more. Our goal is to build a system that, when in place, we'll be able to administer almost 10,000 doses every week. And we intend to be fully prepared once the state is able to increase the supply of vaccine to St. Louis County. And despite this progress, we understand how frustrating it can be to navigate the process of getting registered to get vaccinated. So our recommendation is to register in multiple places. So here's what we suggest. First, register with the St. Louis County Department of Public Health by visiting stlcorona.com. Click on the vaccine registration link and submit your information. We will contact you when it's your turn to make an appointment. Second, you can register at the state's Vaccine Navigator site, and that is covidvaccine.mo.gov, and click on the Register Now button. Third, register at our area health system websites. All of our hospital systems are taking registrations from the public. Finally, touch base with your local pharmacy and see what plans they may have to become a vaccination site. Talks are underway with pharmacies across St. Louis County about offering vaccinations to the public. While we recommend registering at every place that you can, it's important to only accept one appointment for vaccination. And when you get your first dose, go ahead and make an appointment for your second dose. We know that waiting is hard, but we want you to know that we're doing everything we can to build capacity in St. Louis County, to forge partnerships, and to make vaccines available to as many people as possible, as quickly as possible. And in the meantime, as always, continue to keep yourself and your loved ones safe by wearing a mask, avoiding crowds, keeping your distance, and washing your hands. These are all very easy, safe ways to make a real difference in eradicating this virus. And I'd be glad to take any questions.
Dr. Bates, we have a few questions. We'll start with Channel 4. Currently, the state says that our region is getting 35% of the vaccines available, but we have 37% of the population. While 2% may not seem like a large amount, that represents 1,800 doses based on what was received last week. What are we doing to get a truly equitable share of the state's vaccinations?
So the question is, what is St. Louis County doing to make sure that we're getting our share of vaccinations from the state? We've been in conversations with the State Department of Health and our health systems to make sure that the number of vaccines and vaccinations coming into St. Louis County are increasing. And we've seen some increase in those vaccinations over the past couple of weeks. We'll continue to monitor that number very closely and certainly hold everyone accountable who's participating in those decisions.
In a related question, what is St. Louis County doing to get our area up to or above the state vaccination rate of 11.5%? Do we need more cooperation from the state?
Yeah, so our vaccination rate in St. Louis County is about 10%. The state rate is a little over 11%. And again, that comes down to getting vaccines here in St. Louis County as soon as possible, as quickly as possible, and making sure that our health systems and all of our regional partners and the St. Louis County Department of Public Health is prepared to get those vaccines in the arms of people as soon as possible. So we'll be working on that, working on getting more vaccines here and getting our vaccination rate up.
This week, Polk County in Iowa announced that there was a planning error between the county and the state, meaning that up to 14,000 people in the Des Moines area may not receive their second vaccine on time. What is St. Louis County doing to make sure something similar will not happen here?
Okay, so the question is about what are we doing to make sure that the second dose of the vaccine is available to everyone who's gotten the first dose. And we're watching that process very closely. So far, we haven't had any problems in getting our second doses into St. Louis County and getting those to the people who have made appointments for them. We encourage everyone who gets a first dose to, at that time, immediately make an appointment for your second dose, and to always get your second dose at the same location where you got your first dose. But so far, we've had no issues of having the second dose arrive for everyone who's gotten a first dose.
Is there anything you're seeing with the vaccine rollout in other parts of the country that you would like to implement in St. Louis County?
Well, we're certainly watching what's happening across the country with vaccine rollouts. And our health department constantly monitors for best practices, for emerging scientific data, and is in constant communication with our health systems to make sure that the decisions we're making here in St. Louis County with vaccine administration, with rollout, with infrastructure is as efficient and as effective as possible, and we certainly are watching what's happening across the country.
When should someone who is eligible for the vaccine now anticipate hearing from St. Louis County? And does it matter how long ago they signed up for the pre-registration list?
So the question is about eligibility and when you can expect a vaccine. We know that there are a couple 100,000 people at least in that group 1B Tier 2 category that has yet to receive a vaccine, those over 65 or with chronic health problems. We're working very diligently with our health systems to get as many people vaccinated as possible, but we still have a demand for the vaccine that is much greater than the supply. So as that supply increases, we will continue to work through that eligibility list of everyone who is pre-registered. Everyone who's pre-registered with St. Louis County should be getting an email once a week to give them an update about what's happening, where we are in vaccine administration, and what to expect moving forward. But we know that we have several thousand people, a couple 100,000 at least, that are on a waiting list, who are eligible, who have not yet received a vaccine. And as quickly as we can move through those folks and get them vaccinated, we will. But we still could be a few weeks away from getting through everyone on that registration list.
Looks like that's all we have for now.
Okay, thank you.